Good afternoon. New Mexico health officials are tracking a lot of data when it comes to COVID-19. In a new report, the state includes a breakdown of how people may have contracted the virus. Here's News 13's Gabrielle Burkhart.
When someone tests positive, they're contacted by someone with the state who will ask them where they've been in the last 2 weeks or where they may have been exposed. Still, the state's lead epidemiologist says it's not an easy thing to pinpoint. Finding, tracking, and isolating positive COVID-19 cases in New Mexico has been a priority for health officials in the pandemic.
Our test positivity is lower than most other states. This is partially due to the fact that we do better testing.
In an online webinar, acting state epidemiologist Chad Smelzer went over a newly released report on the state's website showing breakdowns of COVID-19 case rates by region, ethnicity, age, gender, and more.
Hispanic or Latino, and you can see that that's been increasing and is our highest percentage of new cases by week for race and ethnicity.
The state is also trying to track where people may have been exposed to COVID-19 before testing positive.
Although we can't tie it exactly, where have they been in the 14 days prior to their positive test result or symptom onset?
The top answer has been consistently travel, with an uptick after 4th of July, then again around Labor Day weekend.
Travel has been consistently our highest potential place or manner in which people were exposed. Again, it doesn't prove causation.
The second highest possible exposure is from attending other gatherings. Third highest is visits to restaurants and breweries, then gyms and places of worship. Still, reporting exposure to the state is an honor system.
I would hope that people would be honest.
If you have someone who's gone to a couple of different gatherings, they may not really be fully aware of which of the activities that they did was high risk.
Now, correctional facilities and residents in long-term care facilities were excluded from that state report showing possible exposures to COVID. Back to you.
Okay, thanks, Gabby. Now, roughly 3.2% of tests in New Mexico come back positive. But in Texas and Arizona right now, their test positivity rates are higher than 10%. You can read the full report at alwaysonkRQE.com.